When we've seen patients in the past, some of the patients will come in, especially if they've seen a consult by me, and they'll say, you know, you're telling me I have gum infection, but I've never heard this before. And I'll ask them, like, when you're at your dentist and you're seeing your hygienist, what have they discussed with you? Oh, like, I have bleeding gums. And that's all they tell them. But they don't realize, what does all that mean? You know, what does it translate into? So when you're here, we'll actually do our exam, we'll do the measurements. When you hear numbers 3 or less, you know, you're in good shape. When you start hearing the numbers 4, 5, 6s, that's a sign of infection. It's a sign of problem that we got to start addressing. The bacteria is getting into the gum line, getting into the bone, and it can cause irreversible bone damage. That's the bone to hold your teeth in. We've got to start educating our patients better. We got to let them know while they're in the chair, hey, this is what I'm measuring for. These are the good and the bad and the criteria. This is where you're at. This is good and green, but this is here in red. You know, this is a cause for concern. It's something we got to start addressing and treating. Because gum infection, there is treatment for it. There's ways that we can halt the progression of the disease. I've had patients come in for their exam and they'll hear me go through my whole thing, and I'll tell them what I'm looking for. And I do 6 measurements. So I'm doing 6 measurements per patient, per area. And they're like, I've never heard this before. I've never been told anything that's going on. The hygienist will mention, oh, your gums are bleeding. I looked down on my bib and I got blood on my bib, but I never understood what all that meant. It's time to find a dentist who's gonna inform you to let you know exactly what's going on. This is your mouth, your body. You wanna take awareness really to the heart of what's going on and how they're treating you. And if that practice or that dentist or that hygienist is not doing this, then it's time to find a new dentist, a new hygienist.